And that's one of the beauties of psychedelics, is that we have the ability to change. But one of the challenges is that the world around us has stayed the same. And that's where
Mhm.
like the
Yeah.
the integration is a huge piece of this. And that's what we do as nurses, is we are working with patients to integrate psychedelics into their life, because they're changing. The brain is physically rewiring, but the world around them is staying the same. It's the same bullshit, but they show up differently and they navigate the bullshit differently. And that's I think a profound thing with psychedelics.
When before I started doing microdosing, I'd done several LSD, psilocybin, macro dosing in order to trip balls. But since I microdosed, I don't feel like I even want to take a macro dose of psilocybin anymore. I feel like I respect it so much more now. I'm like, this is my teacher. This is my medicine. I don't want to abuse this. But so if, and I'm really getting up there in years in my life. I'm not really looking for many more recreational brain experiences. But LSD, if I wanted to have a recreational psychedelic experience, that was many more recreational brain experiences. But LSD, if I wanted to have a recreational psychedelic experience, that's my comfort level right there. How about you? How do you feel?
I feel the same. That first of all, I think with any medicine, it will speak to us and tell us when it's time to stop using, especially with plant medicines. We see this in
Mm.
cannabis. When people start having adverse effects, that's the medicine talking to them, telling them it's not time. When you hear with DMT, long-term users of DMT, they can no longer break through, and the entities have told them, you're done, you're cut off, you're not allowed back here anymore.
Oh, really?
Yes, that is a
Huh.
whole thing
I've
that
never heard that before. That's
people get
interesting.
blocked out of the DMT realm. And I think with mushrooms, it is the same thing. That when with the macro doses, I hear people doing 5 gram trip every month, and that's a lot. Like
That is a
that's
lot.
intense. Macro
Yeah.
doses are, I think that's once, maybe twice a year, maybe 3 times a year. But more than that, then you're kind of just like chasing the high a little bit, and you're not really integrating it into your life and actually changing your life. You're just kind of chasing the high. And so I think that's a really big difference between cannabis and other things and psychedelics. And the medicine will speak to us and tell us to stop coming. And I think the mushrooms have maybe taught them what they need to know for that time in their life, and they don't feel like they need them anymore. And that's the beauty of it. And that's the biggest threat, I think, to pharmaceuticals, is that not needing them anymore.
Wouldn't it be wonderful if, say, I used SSRIs to get off of drugs? I'm sorry, I used psilocybin to get off of drugs, the SSRIs.
Mhm.
Wouldn't it be awesome if somebody showed up in court for some drug related crime and the judge was like, open up, you're going to take this 4 grams of mushrooms right now. We might just solve your drug problem. If there's a chance, if even there's a 10% chance that you could solve somebody's serious drug problem by using psilocybin or some
Right.
psychedelics, why wouldn't you do that? Or why wouldn't you explore that and find out more about it?
Yeah, yeah. And I think that there's huge potential that we'll see, that I would like to see in research in pediatrics and psychedelics, because most people, their shit comes from the childhood trauma. So if we could nip that in the butt, rewire the brain while they are children, and prison populations, if we could use
Oh,
this
wow.
in those sorts of populations and as a tool to help people recover, I think that is research that I would love to see. And I think we'll see a huge change in humanity once that becomes a standard thing, if it ever does.
And the prisoners could grow their own medication. It would be cheap and easy,
Right?
super
Right?
cheap and easy, and
Yeah.
have a skill that they could use when they got out of prison.